for this half hour include our panelists and our call-in partner, VHPI. Suzanne Gordon, VHPI Senior Policy Analyst, and her work expands over 3 decades reporting on healthcare program workers, policy, and have authored 21 edited books. I don't know how she has the time for all that, but Suzanne has written 2 books, The Battle for Veterans Healthcare and Wounds of War. And we also have Brett Copeland, VHPI Executive Director, nonprofit Veteran Healthcare Policy Institute, an organization founded by veterans, healthcare providers, and journalists. Brett worked on Capitol Hill as a communication director for a labor union that represented VA employees. Our discussion today will talk about COVID-19, the second wave, and how the VA is preparing and prevents task force on veteran suicide prevention and our Women's Veterans Forum. So I am pleased, Suzanne and Brett, to welcome you to the show.
Shout out to the governor, and we look forward to talking with him again next time. But this is Brett Copeland with VHPI, and over the last week we've seen a spike in COVID cases yet again across 10 states, with Texas, their San Antonio Veterans Affairs facility there actually having the most COVID patients across the entire VA healthcare system. Mm-hmm. And we know that coronavirus is going to have a big long-term impact on veterans' lives for many years to come, because it's the perfect storm of an economic crisis, a mental health crisis, and a physical health crisis. But even with all of those things, there are more just problems that are happening up on Capitol Hill that could also impact veterans' health care long term. Suzanne and Harold Cudler, who's a professor at Duke University, actually wrote a blog for us this last week. He was the former mental health policy leader at the VA. But in 2022, there's the potential that 2 centers, very critical centers, could be closed just because policymakers are rushing through the legislative process because of COVID-19. But the Center for the Study of Traumatic Stress and the Center for Deployment Psychology could be on the chopping block. And Suzanne, could you talk a little bit more about that?
Yes, absolutely. So it's in the National Defense Authorization Act, which Congress is considering right now. There are significant cuts in the Uniformed Services University, and legislators are not aware that these cuts, in order to balance the budget, the Uniformed Services University will be planning to give less money in 2021 and entirely eliminate these 2 major centers that help veterans and military service members deal with stress and the psychological impact of deployment. Mm-hmm. And the cuts are not a line item in the budget, so Congress isn't even aware of what's going on and that these programs are going to be eliminated. Let me just give you an example of some of the stuff they've done. The Center for Deployment Psychology has trained over 40,000 providers nationwide to deal with traumatic brain injury, suicide prevention, depression, etc. It trains civilian sector providers. The Center for Study of Traumatic Stress has done remarkable amounts to help people understand traumatic stress, not just veterans and military service members, but they've been helpful in the COVID-19 crisis. And, you know, this is a pittance. I mean, we just lost a fighter plane, you know, that cost $63 million, which that is, it's like the budget for these 2 centers, when you compare it for the total amount of the National Defense Authorization Act, is kind of like a penny. And these are going to be cut. It's penny wise and pound foolish at a time when veteran stress is off the charts, because we see 12% increase on unemployment for veterans. We know that financial stress and unemployment is a predictor of veteran suicide. military service members are having the same kind of problems, and this is not the time to be cutting either the uniforms budget or potentially these two programs. And veterans really need to call their Congress people and alert them to the fact that hidden in this budget is the death of two critical programs. And Harold Cutler, who has served in the VA in mental health for decades, contacted me about this, and we decided to write this for VHPI's blog and try to get the word out to Congress.
Wow, that's an abundance of information that is critical for people to know. And, you know, as this time is going on, I'm a veteran myself, a combat veteran, so I did a couple of tours in Iraq. And, you know, it's been very stressful for me having to be at home and, you know, go back into that kind of isolation mode. So our veterans are going through that right now. But we also, you know, I work with help the state out. It's my second job, but I work with the state a bit. And one of the things about deployment and the deployment psychology and the Center for Traumatic Stress Studies, which is critically important for them to understand, is that we're going to be, the National Guard, the military is already involved in deployments internally within our country. And as we recover from this, there is a lot of stress and a lot of things that are going on in our communities. And many of the service members are also involved in those activities and can contribute to that, that recovery period. So it's even more critical for them to be trained properly and to have those resources available to them.
Yeah, I mean, I think Brett and I couldn't agree with you more, and I know Dr. Cutler would agree as well. I mean, if you don't have centers studying these issues, then you can't help people recover from them. And I personally think that, you know, there is just a growing desire in some folks who claim to run the government to just not find things out. You know, it's ignorance is bliss, but ignorance kills veterans and kills active duty service members.
You know, as the general public, and we have a lot of people who listen to this program, you know, to hear Cliff every week, what do you think we can do as veterans, and what do you think the general public can do as veterans to stress this issue? Is it calling congressional members? What should we be doing?
Yeah, I think it's very simple. I think you have to call, you know, you can go online and get their phone numbers or their emails, call your representative. You know, you have one congressman, 2 senators. Takes about 5 minutes. And you just call and say, I want to alert you to the fact that in the National Defense Authorization Act, are cuts to the Uniformed Services University, it trains personnel to take care of active duty service members, medical personnel, doctors, nurses, and so forth. And there should be no cuts to the USU, Uniformed Services University, and particularly no cuts to these 2 programs, the Center for Deployment Psychology and the Center for the Study of Traumatic Stress. I mean, it's a simple ask.
Yes.
Why? I mean, you know, we're giving the Pentagon more money than they need, and yet they're cutting critical programs that are really needed and funding all kinds of things that nobody needs and hopefully nobody uses.
Yes.
Well,
absolutely.
now is really not the time to be taking tools out of our toolbox, particularly when it comes to serving our folks who served in uniform. And I think Illinois is particularly lucky in having a senator who understands veterans' real, you know, unique needs and health issues, especially as they transition from active duty to veteran status.
Yes.
And, you know, now we're actually holding a forum at the end of next week. Again, you are very lucky to have a senator who understands those needs, but also a woman veteran. Yes. Women veteran and veterans of color at this time are at huge risk because of the inequities that exist in the private healthcare system. And by having tools like these two centers, as well as access to the Department of Veterans Affairs, there's that opportunity to receive care if the private sector can't provide it. So we would love for you and your listeners to join us for that forum on women veterans health on June 26th at 1 p.m. Central Time. We're going to have some great policy advocates and experts for veterans with us. Tammy Bartlett from VFW, Maureen Elias from the Paralyzed Veterans of America, Joy Illam from DAV, the American Legion will have a representative there, and Kayla Williams from the Center for New American Security. In Chicago, you all have seen just how badly coronavirus has impacted, Black Americans.
Yes.
And it, that extends to the veteran community. And women veterans and women veterans of color are also, are at huge risk. So we're hoping to have a good conversation at the end of next week on June 26th about that. That's
right. And, we have veterans who are, during this pandemic, who are, prone to, developing COVID-19. But we also have some other threats in the background with, childhood immunizations being down, vaccines for children. And we also have the influenza that we are trying to encourage veterans to get vaccinated for early this year in August rather than waiting till October, November. And so we had to protect our seniors, our veterans who are out there who are seniors, because many of them are business owners. Many of them are integral, community partners, and they are, participating in our communities. And as we restore everything, they are essential. And, Tammy Duckworth, who I know personally, who I'm a flight surgeon myself, so I did my combat tours with flight surgeons and mechanized infantry. But we have her, and we also have some other legislators who in the state, Danny Davis, we have, Dick Durbin, we have Bobby Rush, who was a veteran himself. So we have people who are in this state that are movers and shakers that need to help to support this initiative as well, to make sure that we move towards this. And we have some, Republican members as well who understand the need about this post-traumatic stress disorder. So we need a bipartisan push to make sure that they keep these programs in place. Not only do we not need to have cuts, we should really be talking about expansion in a time period where this is becoming so critical for our veterans.
Oh, you're so right. And the tragedy here is that these legislators, the reason why VHPI did this blog post is that these legislators literally do not know that these programs are on the chopping block because it's not a line item in the budget. There's no reference to these programs. We were alerted to this, and, this is one of the reasons why a group like Veterans Healthcare Policy Institute, in my view, we're both work there, is so important because we can get, we really are focusing on these little grains of sand that often are invisible. And, it's not, the problem here, it's not like the Mission Act where people knew what they were voting on, even though I think they didn't really understand it. This is something that's entirely invisible, the fact that this program may be eliminated. And it's up to us, to make this visible and to call folks and say, hey, wait a minute, if you vote for this, the way it is now, this is really going to hurt veterans and active duty service members.
Oh, absolutely. And unfortunately, we're running out of time. This has been such an important topic. And what I want to do really in the last minute is have you give one thing that's very quickly. So VHPI, is that VHPI.com, or how do people look at that site? And then also,
so if you go to veteranspolicy.org, that's veteranspolicy.org, O-R-G, all our information about the forum and the blog posts are right up there on the front page. And you can subscribe to our newsletter there as well.
Oh, excellent. And that's for that is for the show on the 26th, right?
The 26th.
Oh, yep. Perfect. Okay, very good. I'm so pleased, and thank you so much for being on this show. And I want to make sure that, we thank you as being a partner of this show and making sure that things go, as far forward as we can. And, one other thing, I just want you to make one brief overall plea to our audience to make sure we're supporting this initiative. And tell me what you think we need to hear in the last minute.
Brett, do you want to?
Mm-hmm.
So if you go to veteranspolicy.org, you'll find the blog post that explains the importance of these two critical centers. During COVID-19, we need to be providing more resources that really address veterans' very unique needs that are a result of their service. Because we're not just talking about veterans with these two centers specifically. This is about active duty military members as well as veterans
and their families and their families
and their families. And we can't afford to let them down now.